Hello friends, I'm Dr. Krishna. I'm neuropsychiatrist working at Tender Minds Clinic and at Revive Hospital. Today I'm going to talk to you with regard to treating depression with medication. People have a lot of questions with regard to medication, whether it works or not, and what are the side effects, and does it change the brain architecture itself. So I'm going to answer some of that today. So I hope you learn something with this talk today. So I'm going to talk to you with regard to medication which we are currently using. First, let us broadly categorize as two types. One is older antidepressant and the newer antidepressant. Older antidepressant, there are at least two different types which are we commonly use. One is tricyclic antidepressant and tetracyclic antidepressant. The newer ones are classified into different types, like one is SSRIs, that means serotonin specific reuptake inhibitors, norepinephrine reuptake inhibitors, serotonin-norepinephrine reuptake inhibitors, then serotonin dopamine reuptake inhibitors. I'm going to give you some information with regard to that so that you understand how this works. One of the theories why people develop depression is because of the lower serotonin and norepinephrine in between neurons. The two in locus coeruleus neurons are serotoninergic fibers and norepinephrine fibers in the brain. So if you try to improve these neurotransmitters like serotonin and norepinephrine between the neurons, so they talk to each other better, and so they stimulate more, and so you develop your depression improves. Similarly, people who take a lot of drugs, suppose, and when they develop depletion of dopamine, they develop severe depression. So drug-induced depression can develop in them. So if you improve their dopamine, again you improve their depression. So I'm going to talk to you about some of the important treatment which we are giving currently here. The one is called SSRIs, that is, as I said, serotonin specific reuptake inhibitors. What does it do is it improves the serotonin in between the neurons. One of the neurons will fire the other neurons because they talk between each other. So once they talk between each other improves, your depression improves, but it takes around 15 to 20 days to happen. So there is a little lag in developing those neurons or improving those neuron activities. Other neurons also takes such amount of time. So always, so we always tell the patient to wait at least 3 to 4 weeks before you see any improvement in your symptoms. So once the medication starts, you don't see the immediate improvement. So it takes 3 weeks or 4 weeks before you see some improvement in your depression. And the depression and that improvement goes on improving as you continue with the medication. Some of the people do ask, is there any side effect with these medications? I think most of these newer antidepressant has a very less side effect. More common side effect are just gastritis, and sometimes it can cause insomnia as well. But some do cause somnolence. That means they tend to sleep more. So if they are sleeping more, we tell them to take at night. If they don't develop any problems with sleep, like insomnia, then we tell them take in the morning. So you can change the medication accordingly. What else? People do tell like it may cause kidney disease and liver problems. No, newer antidepressants are very safe. It can be used for many years without getting any side effect. toxic dose are very high. Even if the patient takes around 100 tablets of some of the SSRIs, they don't die with that. So that amount of safety is there with these medications. So how to choose antidepressant? These antidepressants are chosen based on their side effect profile and what the patient comes with, how they are feeling at that point, and what are their health issues. Depending on that, we try to give the antidepressant specifically depending on the each patient how they come across. So it is almost like tailored to each patient. So we can use from variety of this medication. There are multiple medications are available in each group. So this is a small brief about antidepressant. In future, I would like to talk more about that. Thank you very much.